Hello, SNA members, and welcome to this week's meeting. Today we've got a special guest speaker activity for you guys. We have some new grad nurses who are going to sit down with us and answer some questions just about what life is like as a new grad nurse. So Sarah, you want to kick us off with some questions?
Yeah, so first off, I just want to ask everyone to introduce themselves. We'll start with Alex.
I'm Alex. I started in a progressive care unit about 7 months ago.
Thank you. And Lee?
Hey guys, I'm Lee, and I have been a nurse for 2 months, which is so crazy. And currently I'm in postpartum.
Thank you. All right, Zoe?
Hey guys, I'm Zoe. I work in an ICU and I've been a nurse for about 8 months.
Awesome, thank you. And Camaria?
Hi, I'm Camaria. I work on a progressive care unit with Banner. I've been there for about 7 months.
It's the first very easy question. Day shift or night shift, and what do you work at and what do you prefer? So I'll again start with Alex.
I work days. I have not tried nights. I'm happy to work days just for like the lifestyle schedule of it, but I definitely was told that like nights is sometimes a great place for new grads to start. But days has been tough, but I've been able to work it out.
Great, thank you. Okay, Lee, I'll go to you next since I started a
Okay. Okay, so I'm on nights, and nights is hard. I'll just say it. The money is nice because you get like shift differential, and the other thing I like about nights is even 2 months in, I'm still like terrified to talk to doctors, and there's like almost no doctors on nights, so it's really great. But I think eventually I would try to switch to days. But as a new grad for now, like the pace is pretty chill, so that's a big pro, I guess.
Okay, so Zoe, what do you think? Day or night shift?
I am on nights right now and I actually really like it. I was a PCT before I became a nurse and I was always on day shift and totally thought I would hate nights. But we have a really awesome crew and our docs are super great and we don't have like a whole bunch of specialties wanting to work with your patients, so you really just kind of get to work just you and your patient, so it's really nice.
Awesome. So Camaria, what do you think? Oh, you're muted still.
Sorry. I'm days. I have tried out a night shift. I was a resource person just because I wanted to see how it was. And I know a lot of people on nights and they're like begging me to come to nights. But I think there's pros and cons to both of them. During the day, you have a lot more access to your doctors. I don't know if I should say this or not, but like you can text them and like ask them if they can call you or whatever, if they're just more easily accessible. You have more support, you have a HUC or a unit secretary that makes your calls for you, all that good stuff. But at night, you lose those resources for the most part. I know it's different for like ICU because those people are more critical. For PCU, basically like they're really close because they have to help each other out a lot. But like I said, there's pros and cons, especially with nights. You know, it's hard for some people to stay up. So yeah.
I definitely think that adjustment would be hard because you have to adjust your life to it, like the different sleep schedule and everything. So
Exactly.
it's an interesting thing that we have to think about. Okay, so the next question that I have is, I don't know if everyone wants to answer this, but it's just like a general question. How long are new grad programs, like the commitment or the contract, what's like the average? Are they usually 1 year, 2 years? Like, how long are your guys' contracts for?
Well, I know that with Banner, their new grad program is 1 year, and I know at Abrazo it was a 2-year commitment. I can't speak for the other like facilities like Honor Health and those types. But then I do know that they're always changing too. So even if like for my experience was like 1 year, it could be that, in the future it'll be different.
So I work up at Flagstaff Medical Center, and my commitment was 2 years, and that's been pretty standard that they've kept.
I'm at Abrazo, and I also signed a 2-year commitment.
I'm actually on the same unit as Alex at Banner, but it's about a year. I think after 6 months they switch you from Banner staffing to a core position, and that's when you can start like precepting and stuff like that. But you're considered a new grad for your first year.
So Lee, just a question on yours with Abrazo. When you sign a 2-year contract, do you have to stay nights for your whole 2 years, or can you switch to days or like a different position on a different unit?
That's a great question. I should know the answer to that. I'm not 100% sure. I'm pretty sure I could switch to days if a position opened up. From my basic understanding is that it's just a commitment to that hospital, and I think I could even units. I'm not 100% sure. That's a question.
I just remember hearing, I think previous semesters, the Banner New Grad recruiter came and said a little blurb about how the Banner New Grad program, you're like locked into that shift and on that same unit for the whole year. So I was just curious, like how.
I have a question about that as well, Sarah. Sorry to just throw this in. So I've heard some new grads talk about like there's an orientation period and then there's like the rest of the time that you're employed. So what does that look like for you guys? Does that mean you go in and basically like, is it 12 weeks? Is it, like 6 months? What is an orientation period? What does that mean?
Go
Go ahead.
Well, for Banner at least, sorry, I didn't know if we were still talking about a browser or not, but for Banner at least, you, depending on your specialty, I know it's different for ICU, they get more time, but for the PCU, what was it, Alex, like 14 weeks the most?
I think at the most. I think it was right at that, like when COVID was ramping up, and so they were trying to get us off orientation once we were comfortable. But I think I did 10 weeks on orientation. I asked for an extra though. I just wanted some more time, and they were fine with that.
Yeah, I think from what I remember, I think it was like 11 to 13 weeks were like your normal, and then if you hit that 11 and you feel like you need more time, they give you like an extra week if you need it. I told my Ross, or the person who kind of oversees us, that I felt like I needed more time for my time management, so they just added on like an extra shift or two just for that time management aspect.
So at Abrazo, I'm getting 12 weeks. From what I'm understanding, that's like the standard. But our director is trying to cross-train all the new grads coming in. So I'm going to do the 12 weeks in postpartum, and then I'll get 2 weeks in labor and 2 weeks in nursery. And if, I guess if I do well and there's a position open and I don't want to like stay in postpartum, then I would get, 10 more weeks in labor or 10 more weeks in nursery.
Oh, that's good.
For our program, it was 14 weeks of orientation, and that was pretty standard. If you needed more, they would kind of like do it on an individual basis, but kind of with the whole COVID situation, we didn't really get a choice.
They're like, we need to.
During the period,
we're like, and out the nest.
During the period of orientation, you're not like directly caring for patients. It's not like to my understanding, the purpose of the new grad program is like you have help, you have resources. We're not like throwing you into the fire kind of thing. So what is orientation? Is it, I mean, I know what the word orientation means, but the thought of like, it's all like very new, and it's very, so if you could just explain maybe a little bit more, I hope that makes sense.
So for us, like you started out, but just by just following your preceptors, you were assigned like one or two preceptors who you were with, and then you kind of like, if needed, got moved between people, but for the most part stuck with a couple of people. And then you shadowed them, and then you took one patient, and then you took two, and then you maybe spent a couple days with two, and then a couple days with three. For in our unit, they have us do a few days of five, because like during COVID we had 5 every day. But then you are the primary nurse, and especially as you get more patients, your preceptor's always there. They don't have their own patients, but they're there for whatever you need. If you have a question, if you need help with wound care, if you know, whatever the situation is, they're always there, but you are the primary nurse.
So it was kind of that same setup for ICU. We actually had like a new grad lectures that we had to go to, and so they were pretty heavy in the beginning of orientation, and then kind of tapered off as you were like expected to kind of be more on the floor and learning. And so I do feel like towards the beginning they kind of gave you the like more stable ICU patients, if that, as silly as that sounds, and kind of as you progressed you got like 2 super sick patients that they wouldn't normally pair together, but because you have kind of that like extra backup and safety net, that they were, you know, like giving you a challenge while you still had that safety net. So
Gotcha. Okay. Thank you for clarifying that. I feel like I hear a lot of new grads like talk about orientation, and then when they're done with orientation, and so I've always been confused on like what's the difference in those things. So thank you for speaking to those. Madison, would you like to ask some questions?
Yeah, so I know you ladies kind of already stated the units and stuff that you're working in the hospital. My next 2 questions have to do with specialties, so I'll kind of just ask it together as a loaded question since they're pretty similar. So first off, is it challenging to get started into a specialty as a new grad? And then also, if you guys can mention, did you specialize right away? Why or why not? Do you regret that decision? Are you happy that you made that decision? What are your thoughts? So I guess we can start with Alex.
When I graduated, I wanted to be in the ICU. And I know that it's possible to start in the ICU, but you definitely have to have some networking in place, and there's limited positions, and I was eager to be, but knew that I would learn a lot. Oh, my connection's unstable. Okay, can you hear me now?
Yeah.
Okay. I know that I've learned more than I could have possibly imagined in the last 7 months. And I know that like, I'm going to be a better nurse for this. Like the amount of time management, or the amount of time management skills and stuff that I have, and just generally what I've seen. And it's also interesting. I was just talking to Zoe about this earlier today. I'm not sure if I want to be in the ICU anymore after being on my unit and seeing, learning things about myself and about the patients. So I don't regret starting where I have started. I just think that if you know you only want to do ICU, or you only want to do labor and delivery, or only whatever it is, like wait for that position. But if you are kind of in a gray zone, like there's a lot to learn no matter where you go.
Awesome. All right, we'll go with Zoe.
So I knew pretty early on in nursing school that I wanted to do ICU. And as I mentioned before, I was a PCT at my hospital. And so I just kind of made sure to be slightly annoying to all of the ICU managers to make sure that they knew when I graduated and that I was very interested in working on their units. I absolutely don't regret specializing early. I knew kind of where my passion was and where I wanted to be. And I got my job in the neuro ICU, which is amazing, and I love it. So I'll actually be doing like the neuro class probably in about a year. So that way I can take on like more complex neuro patients, but I absolutely love my unit. So
Neuro ICU, that's actually really cool.
yeah. We also just opened up a surgical trauma ICU, which is also super cool, but
that's interesting. And just personally, I think it'd be cool to see everything that comes in and out of Flagstaff. I've only been there a handful of times, and it was for like skiing accidents, but it'd be neat to see the hospital. But
yeah, We pull an interesting crowd.
Camaria?
I didn't really know what I wanted to do. I thought maybe if I just started with med surg, then I could kind of like get my bearings and then go somewhere if I decided something else. I actually only started working on the PCU because I had a friend who requested me, and that's how I ended up where I ended up at. But I don't regret it at all. I really like the PCU. I think COVID was kind of a blessing and a curse because, like Alex was saying, you were kind of like, or maybe you weren't saying this. I think someone else may have been saying it. I think it was Zoe, but saying that like you kind of got like pushed to start sooner because of COVID, which was very difficult. But you learned a lot faster, if that makes any sense. And we had like a lot of different types of patients. It wasn't like we don't have like a theme to our floor. You get cardio, you get respiratory, kidneys, like anything you can imagine, like we get those patients, which I love because you get so much experience so much faster than I think you would normally. I can't remember all the different parts of this question, to be completely honest, but I do know there was people who like knew what they wanted to do and they went into it. I think it also helps, like Alex said, is like it's who you know for the most part too. If you have people who are requesting you, like you're almost a shoo-in to get that job. And what else was the other part of that? But yeah, no, pretty much I don't mind working where I work. I like it a lot. I plan on staying on the PCU for a while. So yeah.
So networking is definitely important if you're trying to get into a specific area.
100%. It's really who you know. Like it's really who you know, especially if you're going into a specialty. Like if you know people on that floor, like referrals are basically almost everything, especially when you're a new grad, in my opinion.
Yeah, I 100% agree with what Kamara is saying. If you don't know someone, you could be waiting like months to get a call. And if you want like something super specific, the likelihood of you getting that is, I'm not going to say slim, but you have to be like in the right place at the right time if you don't have a good referral. But as far as talking about like specializing, I guess I have a little bit of a different viewpoint than everyone else because women and infant services is so specialized. Like I don't see anything except for basically two types of patients, vaginal deliveries or C-section, you know? And so I don't know, like on the skills aspect, I wouldn't say, I don't feel like I'm losing a ton, but on the like patho part, I think I am because I'm only seeing those two things and our assessments are the same and our meds are the same and our everything is the same no matter what. That being said, I knew that I loved moms and babies and I also knew that ER would be really cool. I happen to have a referral for women and infant services. And so for me, I was a little bit worried to specialize so soon because what if I didn't like it? Like as a new grad, you may think that you like something and then you start working and you're like, oh, it's not exactly how I pictured it or whatever. But for me, any experience was good experience because I don't have a background in healthcare. So I just wanted to get my foot in the door as soon as possible. And thankfully, so far, I've been loving it. If I ever wanted to switch down the road, I'm not sure how difficult that would be for me. But yeah, any experience is good experience, in my opinion.
I don't think that's a wrong mentality. I think everyone's saying that. And I think that a lot of like the students that like I've talked to are really nervous just being with COVID and stuff because we didn't really have access to a lot of our specialty clinics. And so I think that's something that everyone's kind of worried about is like a specialty. Should I go into it? Should I wait? That kind of thing.
What are
are some misconceptions maybe that you learned while you were in the program, like stuff that was kind of instilled in you that turned out to be false when you entered into the workforce as professional nurses? We'll start with Alex.
I think one fear that I had that has not come to true at all was like the whole like nurses being mean to other nurses. Like I've like all of my coworkers are wonderful. I love them, Camaria included, but like we have like a really awesome floor, and there are a lot of new grads on my floor, but between all the preceptors and all the travelers and all the experienced nurses, I haven't seen any like even an ounce of that, which has like been really good, because I was genuinely worried about being like, oh, it's a new grad, like I don't want to work with them, they're so dumb, but that's not been the case at all. So that was awesome.
Awesome, I love that. Camaria, you want to answer?
Kind of piggybacking off of Alex, yeah, with the diversity 3 type of thing. We were super lucky because our floor is mostly new grads, are mostly new grads. Yeah. Anyways, just to add on top of that, but like doctors, there's probably 1 out of 10 doctors that are like jerks and don't respond to you well, especially as a new grad. I would say our hospitalists on our floor, like, super approachable. They take what you say and they actually listen to you. And even as a new grad, like, we haven't been doing this for this long, but for them to like respect your opinion and to take it into consideration for the patient's care is like huge. Because I mean that 1 out of 10 that do talk to you like you don't know anything, like that can really hurt your new grad like heart, I guess, or like self-esteem. So yeah, just because I can't really think of anything else that's like a common thing that you think of as like a nursing student, like, oh, it's gonna be like this. Nothing I can really think off the top of my head. Do you have like examples of things that you're like afraid of that you think maybe like a common misconception?
I think what concerns me is there's such a plethora of information that we learn in the program. So being able to utilize all of that and to be able to retain all of it through the 2 years that we are in the program and then approaching it into the professional world, that's a concern for me.
Okay. Oh, sorry. Are you done?
No, go for it. That's it.
So that's the thing too, which I think is so funny because you do learn, there's so much information that gets poured into your brain over that whole nursing program. And you come out and you're just like, oh my gosh, I can't, like, what does insulin do to potassium again? Like, oh my gosh. So then there's the fact that you still have to do like continuing education, no matter what floor you're on. They're basically going to teach you everything all over again, but just in like a more condensed form. Like me and Alex are still going through a PCU academy where they're basically going over like each session is a different thing. So they keep you up to date. They remind you of things. And I'll never forget what Professor Bell said at our promotion, where she was just like, now you get to cheat, because you do. And there's resources and there's people you can go to and ask. Like, and during COVID, it was a little scary because they always say when you get off of orientation, like, oh, you're never alone. Like, you're okay. There's always someone that can help you. And then COVID hit and you're just like, where is everyone? Because everyone was like drowning basically every day. But it's getting a lot better now. Just to answer your question, basically, like, you can cheat, like, you have the internet. I mean, just the other day, I was like, what does insulin do to potassium again? Because my patient's potassium would not go up. But anyways, just to narrow it down, you are not alone, especially during days, because you do have a lot of support. Just go bother someone. There's always that like experienced nurse that wants to like take in a baby new grad and nurture them. I mean, I was lucky because I had 7 preceptors. So whenever I need help, I'm just like vocerating like 7 people to see who answers. But you're not alone. There's always resources, even at night. I don't know how night goes, but I mean, there's such a close-knit family during your nights that I've noticed that you're never alone. It's gonna be okay. It's all right if you don't remember small things.
Okay, good. Thank you for that. Zoe, do you want to piggyback on that?
Yeah, so I think you guys touched on a good point about like the doctors. Like I was terrified to talk to like our ICU docs because I'm like I don't know anything. Like how am I supposed to make a recommendation to this doctor who's been doing this forever? And I'm like, do we want to keep this going? But I find that a lot of them are willing to like have a conversation and like educate, and not in like a, well, why did you say this sort of a way, and like a, hey, this is why we're doing this. Or like if you don't understand like a course of treatment for a patient, just asking questions, whether it's your doc, your charge nurse, anybody on the floor. Like you're not expected to know everything. And I feel like that was something that I was really intimidated about going into ICU. Like I'm surrounded by people who have been doing this for 15 plus years and they just seem so knowledgeable. And I'm like, well, I'm not even close to that. Like, and so just using your resources and not being afraid to ask when you have a question, because there's no dumb questions. Like I would rather seek clarification than do something wrong. So yeah, that would be mine. Just ask a bunch of questions and don't feel silly about it. There's still stuff to this day where like some days you'll have shifts where you're like, okay, this is cool, I got this. And some days you're like, I have never heard of this thing in my life. And the nurse sitting next to you who's been doing it for 15 years has also been like, oh, that's weird, I've never seen that. And so like we're in such a field where you're going to be exposed to so many different things, and it's okay to not know the answer. But what's important is to be like, oh, I don't know that. Let me find somebody who does, or hey, Google, like, so.
Self-reflection is very important, it seems.
Yeah.
Can I just add that what Zoe's saying, if you don't know something, say you don't know it. Like, don't fake it till you make it. Like, no, I don't know this. Like, please tell me, you know what I mean? Because when you feel that pressure that you have to know everything, because I think that's what nursing school does to you. But when you're in nursing, like, if that's someone's life, you know what I mean? So if you don't actually know something about a patient, it is 100% okay to say, I do not know, but you know what? I'm going to try and find that out for you, especially if it's a super intimidating doctor and they're like, why don't you know this? And it's like, I don't know, because I got this patient 20 minutes ago and I don't even know who I am anymore because I've been here for like 10 hours and I'm struggling. To add that, do not let people pressure you into feeling like you need to have an answer, because you don't always have an answer, like Zoe said.
You know what? I honestly really appreciate you saying that, just on a personal note, because I know for a fact I'm the kind of person that like I'll study, but then I'll go into a sim and I always tell myself those exact words. I'm like, oh, I guess we're gonna fake it till we make it, because it's like this is the best I got. And so I appreciate you guys coming on here and letting us know that like you always have help, always ask questions, that you can cheat now, that it's a little bit different than nursing school.
Everyone else already said like really good things, and I'll just say that I'm really jealous of everyone else's doctors because mine do not feel that approachable. But I guess, yeah, I'd just like to go back with like what everyone else has said. Like, it's not nursing school. If you don't know a med, just look it up. Like, no one's gonna crucify you for not knowing something at all. And I think as a new grad, it's only been 2 months, but I've learned that if you need help, like, it's okay to ask for help. And for the most part, people are super happy to help. But I think you got to be smart and find those people, like Camaria having 7 preceptors. That's really awesome. I've only had 2, but I know, like, if they're not available for whatever reason, then I've like found those people I feel comfortable like going to. Sorry, he wants to talk too. But yeah,
that's okay.
It's not nursing school. If you don't know something or you don't know the ins and outs of something, just ask, because people are going to be more scared if you're not asking questions.
Okay, cool. Thank you, Lee.
I wanted to add on to that, like, the same thing as Madison. I really appreciate you guys saying that, because I think the culture in nursing school, at least for me, is like you need to know your stuff, and like you have this level of anxiety to like be on it, like know everything in sim,
Scary.
all this, and it really does almost. I know personally for me, like sometimes I'm scared to admit that I don't know something, or like I'm scared to ask that question because I don't want to seem like I didn't study hard enough or anything. But just to know that like that, you know, we're humans, and that it's like everyone learns at their own pace, and there's just this different culture when you get into like the real world of nursing that nursing school can prepare you for. That's good to know, and it's thank you guys for sharing.
Can I add
Definitely refreshing.
to that is that you're gonna know a lot to walking into. So like, I don't want it to feel like you just walk in like, I mean, you are a blank canvas, but you'll be like, yeah, I remember learning about that. You might not remember every detail, but you're gonna like be like, oh, I see why I studied that. I see how that applies here. And for me, that was really awesome to be like, I learned about this in school and I'm literally seeing this like in front of me, which is for me really exciting. And then with the doctors, I ask a lot of questions, especially in the last month or two, and I find that a lot of them are happy to help me understand because it makes their job easier because then I know what I'm looking for and how to report stuff appropriately to them. So it's been fun, like asking, like quizzing the doctors and then having them like explain it in this like doctor way, and I'm like, whoa. So that's cool too.
That's cool.
I'll add something like going off of Sarah, what you were talking about is when I first started, I was like so terrified I was going to get on the floor and nurses were going to just like start quizzing me, like, what do you know about placental abruption? Like, blah, 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 blah. Never once has anyone quizzed me about patho or med or anything. They'll say, hey, we have this patient with a history of blah, 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 blah. What do you know about that? And it's in a really like, tell me what you know so I can fill in the gaps, not a why don't you know X, Y, and Z about this situation. So that's been my experience.
I love that about L&D and postpartum stuff. It seems like they're such a welcoming community. I would like to talk about NCLEX if you guys are up for it. Just like your experiences with NCLEX and any kind of tips and tricks, because obviously throughout the entire program, like they definitely encourage us to buy the NCLEX books and study the NCLEX questions so that we can kind of get a better understanding for it. So if you just want to talk a little bit about it, your experience with it, all that stuff. Lee, since we can just start with you, since I see you on the screen.
Sure. I personally use the Saunders book, and then I did also get UWorld. I think I tested a month after graduation, and if I have any recommendation, it would be to like try to go in that 2 or 3 week mark. Like, don't drag it out, because nursing school really is the best preparation for NCLEX. I don't think you're magically gonna learn like a ton more info studying like a bazillion hours a day afterwards. So yeah, UWorld was awesome. Honestly, it's pricey. If you can share it with someone, I would recommend that too, to bring down the cost. And then yeah, I say try to test in 2 weeks.
Okay, thank you. Zoe?
I just used the Saunders book and just kind of kept taking questions. If you can pass Johnson's exams, you're going to be fine. That's how I felt. And kind of going back to like your block one strategies of like, what is this question actually asking you? Because I feel like the NCLEX questions were like pointing you almost to what the right answer was. I don't know if that was just me, but I felt like they were almost like, it's B, or you know, like which one is like heart failure-y, or, you know, so there were a lot of like hints I felt in the question, but it was, and just like take your time and breathe. It's okay. Like I know our group was obsessed with our lavender, and so I like doused myself in it before I went into the NCLEX, and the lady was like, you smell very nature-y. It's like, thanks. Yeah.
That's funny. Kamaria?
I agree with what Lee and Zoe said. Basically, you do want to take it faster or sooner than later. I think it's kind of like the same mentality as when you're going to take an exam. Like, there's no point in studying the day of the exam, like before you take it, because if you don't know it by then, like you're not gonna know it when you take the exam. So I did. I started off. I had this whole plan of going through the Saunders book and answering questions on all that stuff. But then I had a friend who finished her U-World faster before or sooner than she thought she was going to test. So I just took over her U-World. I highly recommend U-World. I believe that the questions from U-World kind of mimic the questions from NCLEX. I think I even saw like maybe two that were like almost identical. But yeah, test sooner than later. U-World, I suggest U-World. And like Zoe said, just I think really what most of it is like you know that information. You got through nursing school, so you must know something. So just go in with like a positive mindset. Don't freak yourself out. That's what I told all my friends that tested after me, like, calm down. Go in knowing that you're gonna pass. It's all, self-assurance and your mindset. That's what I would always say. It's like, it's your mindset. Don't go in thinking, oh, I'm so scared I'm gonna fail. No, go in, oh my gosh, I'm so excited I get to take this test. I'm gonna pass. And you should do fine. Don't freak
It's a good mentality. That's
Yeah.
good. Okay. And Alex, you got anything to add to that?
What everybody else said for sure. Take it soon. And then what I did with my friend Rena, we took it on the same day, same time. And the week before we went and we drove to the facility, so we knew exactly where it was. We walked up to the door. We got all of that stuff that we knew was going to make us extra nervous out of the way. And then the day of, we knew exactly where to park. All of those nerves were gone, and we could just really focus on the test. And I'm not typically the type of person that does that kind of thing, but for that exam, it definitely helped me kind of calm down a little bit.
That's a great idea, actually. I didn't even think about that. That's cool.
Yeah, that's really good advice because I get really bad anxiety when it comes to the little stuff like finding a parking spot. Where do I go? Where do I, So I think that's really good advice to take. Just drive there, see what the environment's like. Get a taste for it. Thank you.
For sure. So I actually have two questions. The first is, what is your favorite nursing tool or accessory or something that you use daily whenever you're treating patients? I think that I have a habit of getting lost in Amazon with all of the things that you can have. So what are your recommendations? I'm sorry, Zoe, you want to start? Sorry, I forgot.
I think the number one thing for my new grad brain and trying to get everything organized has been a brain sheet that works for my brain. At my ICU, we have a standardized report sheet. And so I have that on the front, and on the back, I basically have a grid where I can lay out my stuff hour by hour and a section for my notes. And that just kind of helps me stay on top of what meds I have, what assessments I need to do, what am I checking on this patient. And so I would say that has been my most valuable tool. And I have a little flashlight on my badge with working night shift. If I don't have to wake up my patients, I can just kind of peek with my little flashlight. So it's kind of silly, but I use it every night. So
awesome. Really cool. Camaria, what about you?
I agree with Zoe. I started off because I always made my own brain sheets in nursing school that made sense to me. My floor has a report sheet that tells us everything that's going on with the patients, but not necessarily a thing to help you organize your thoughts.
Okay.
So a nurse that's been actually she's gonna start working at Estrella here soon. Teacher Naltes, she made a brain sheet, and it's literally it's for 5 patients, and it hits every single thing that you need to do before you leave for your shift. So there's different things that different nurses are expected to do, charting wise, all that good stuff that you don't even know about until you start nursing. So I would agree with that for sure. Organizing your thoughts and making sure that you have boxes to check off. So especially when you're starting is super important in my opinion.
Awesome. Lee?
We have report sheets too on my floor, and I honestly, maybe just because I'm super fumbly still, I feel like I don't even have time to look at my personal brain sheet. I'm literally just following my report sheet still. So I don't know, I can't think of any like gadgets. The only thing that I have gotten is a really good jacket because it's freaking freezing on night shift.
Alex, what about you?
I'm gonna go with the brain sheet too. I got mine from my preceptor. The thing that hung me up the most when I started was the charting and keeping track of all the charting, especially when we had 5 patients. And like, it takes a lot of time to chart and then to like go back and be like, did I chart that? I can't remember. And so my brain sheet has like all of the charting. Like once I do it, I can write in when I did it. And then I also have like my system for like, this is my wish list that I need to ask for the doctors. Like this is their mobility, like all of the different things that I know that somebody's going to ask me during the day, or if they need like a scan, and like I want to make sure I look up what are the results of the CT. Like I have that on my sheet. But then just to go like one step further, I still use my folding clipboard. I know a ton of people in our cohort had that folding clipboard. And it is awesome. Like I keep it on my like workstation, and I just like am constantly going back to it, and I can put it in my pocket and all of that. And so I love my clipboard because I keep my brain sheet plus my report sheets all there. And if I get a piece of paper that I need to keep track of, I just stick it on. So that has been helpful.
Awesome. Yeah, I have a folding clipboard and I love it so much. Going back to Zoe, what is one piece of advice that you guys would give to future new grads? Coming up really soon. Sarah, it's happening for you very shortly in a few months. Madison and Tori and I will be graduating in May, and the thought of becoming a nurse is frankly very terrifying for me. What's some advice that you guys would give?
So I think my favorite piece of advice that I got from the educator at my hospital was that there's always going to be things that give you a pucker moment. And her thing is like sphincter tone, like kind of those things where you're like, oh, like and like there's always going to be things that make you do that, but it's what you do with it. So if you don't go get help, or you don't, seek out like answers or other people to help you, like that's not the right response to that. Like there's always going to be things in your nursing career where you're like, oh, I haven't seen that before. Like, oh, what do I do with that? Like, and so just knowing who your resources are and knowing that it's okay to not know the answer. Like we've talked about before, you're not expected to have all the answers to everything, and that's okay. Like basically the second that you stop having moments where you're like, I'm uncomfortable, like you should probably find a different career.
Lee, what about you?
I think the biggest thing I would say, which we've already really touched on, is to network and be open. Like I know it's great to get the specialty that you really want, but if you are able to make a connection with a nurse on a unit that you're like, oh, maybe, like keep that in your back pocket. Because I guess I was a little bit surprised to see how competitive actually it is as a new grad. And if I hadn't have made really good connections during clinicals, I'm not sure that I would have the job that I have. So I think, just working super hard and being kind to anyone and everyone you meet, you never know when you might need a reference.
Camaria?
I would say my biggest advice is to be confident, but to also remain teachable. I think you doubt yourself so much as a new grad. You're in a new environment, you're taking on a new role, even just wearing those navy blue scrubs for the first time on the floor, like you feel like an imposter. But just believe that you know what you're talking about. If you have like trust in your gut, know that you graduated nursing school, you passed NCLEX, you deserve to be there. But at the same time, you're not going to know everything. So ask questions, reach out, even if it comes to like, there's CNAs that have been CNAs for longer than I've been alive. If sometimes if I have a question, I go to my CNA that I've known, like that has been a CNA for forever. I was just asking her questions the other day regarding a Foley, because I've never actually taken like the Foley apart at the, sorry, someone's blending something in the background. Anyways, I've never actually taken like a Foley apart to like flush it, and she knew about that and I didn't. So just that. And then another thing going off of Lee is literally like try and be nice to every single person that you meet, because even if it's someone in street clothes in the hospital, like that could be the CEO and you have no idea, and you just like, you're having a bad day and you didn't talk to them in the elevator, but that could have like been someone that, you know, could have been an important person to have a conversation with. I think like she said, when you're at work, like those connections are everything, especially if you want to get into a different field than you are already and you just started there so you could get there eventually. Just make friends with everybody. Like, and that's the thing too, they say nursing, the nurse world is so small. Like it really is. You could be having a bad day and talk crazy to one person just because you're not being rational, and the next thing you know, like, oh, they're best friends with so and so, and now you look bad. So like I said, just even if you're just having like something annoying is really happening and you're just really flustered, like just try and keep like a positive mindset. I think that's what got me through the COVID like part of nursing. Even though it's still going, like it's not as bad as it was. It's not 5 patient assignments, everybody's running around with their head cut off bad. Now it's a little bit more chill. But yeah, long story short, try and keep a positive attitude, trust in your gut. And then just one more thing I wanted to add was that it's better not to do something because you feel like it's not right than to just do it. Because you can't go back and explain like, oh, I didn't think I was supposed to do that, but I didn't want to not do it. Like it's always better, because there's also things where you're like, oh, well, why didn't you do that? And you're like, oh, I didn't know I was supposed to. But don't like give the 60 units of insulin because it was ordered. Because then it's better to say, oh, I didn't give the 60 units of insulin because it didn't feel right, than to say, oh, I gave the 60 units of insulin because it was ordered. Like you have your license, so put it to effect. Don't do it just because. That's my spiel.
I love that.
I would just say, like, kind of going off what Kamaria said, like, trust your gut. Like, you are a well-educated individual, and sometimes stuff just feels wrong, and sometimes you can't put it into words, but you just have this gut feeling. The first time that I had a patient go south, like, I just looked at him and was like, I don't know what it is, but I don't like it. And I didn't have a reason. There was some little gremlin that was like, this is not okay, and I don't know why. And that's okay. That's kind of one of those situations where you talk to your people around you, you find your preceptor, your charge nurse, somebody where you're like, I don't like it and I'm uncomfortable. And, you know, kind of start going through your things of like, are they symptomatic? Are they not? And like work through your checklist, and eventually you'll get there. And sometimes your gut is spot on. Like that night, my gut was spot on. And I couldn't have told you at the beginning of the shift what was wrong with him. It just looked not great. So trust your gut.
That's really good advice. I think I struggle with that, even just being in nursing school. Like the idea that, okay, I'm pretty sure that this is the right answer. I'm pretty sure this is what I'm supposed to do next, but I'm not 100% sure. So I'm just not going to do anything, and I'm just going to stand here. So yeah. I'm definitely victim of that for sure.
Well, and like you don't always have to have the answer, you know. If you just see something funny or something changes, like grab a buddy. You know, in nursing, you're never alone.
Yeah. Lee, did you want to say something to that?
Yeah, I was gonna add one thing. I think just going off of what Zoe's saying with trusting your gut, like definitely don't ignore that. And I think one thing that I found that is I think important as a new grad to understand is that just because someone's been a nurse for like a bazillion years more than you doesn't mean that they don't make mistakes, and that you shouldn't listen to your gut and your knowledge and your training, because I've seen nurses that you would think like, oh well, I'm sure they know what they're doing, they've been a nurse for X amount of years. That's not the end all be all. And I think like as a new grad, it's scary to be like, hey, I know that she did it that way, but I don't feel comfortable with that. Like this is the best practice that I'm familiar with. And I think you got to trust yourself and go with that sometimes.
That's awesome. Alex, do you have any final advice for us?
The trusting your gut thing, like absolutely. And then like advocate for your patient. Like if like my first shift off of orientation, I had to upgrade a patient and I couldn't explain why, like Zoe was talking about. I'd had him and there was something wrong and I could not figure it out. And I had to advocate, like I had to like push back, and he was upgraded and he needed to go to the ICU. So definitely like if your gut is talking to you, like don't just let somebody silence you until more than one person is like, no, here is why it's not what you're thinking, or, you know, whatever the case is. Because that is somebody's life, and it's better to like be a little bit overexcited and like trying to figure out, is there something going on here, than to be like, I don't know, it's probably fine. Think about like if it was your parent or something, you would want someone to be looking further. But then the other thing, and I had to remind myself of this a lot in the last several months, especially when COVID was at its height, when everything was like super hard and I was really, really struggling at work, just being overwhelmed, is I would try to look for the moments, like I would remember why I became a nurse in the first place and try to find those moments. Like for me, it was because I wanted to be there for families and patients during a hard time. And a lot of times you're so task oriented that you don't have a second to like remember that stuff. And it's just like, I just have to cross all my things off my list because a million people are counting on me. But I had this one patient who's a neuro situation, and I was able to like, I think make a difference for that family. And it wasn't about like me finding like an amazing assessment finding. It was just about me being present with them on the phone and with their loved one. And I got a lot from that. And it reminded me like, okay, even though this is really hard and I'm really stressed out, like I'm so glad I'm doing this because I have the reason in front of me, like why I'm doing this. So definitely keep looking for that stuff, especially when it's hard, because it will be hard, but there's no homework when you leave. So that's a really good thing.
That is such a plus. I cannot wait until I'm done with school and I don't have to do any more case studies or concept maps. They're definitely not my favorite.
Alex,
do you guys have anything to add?
Alex, I always have homework. I have like bazillion learn share thing to do. Always.
It won't always be like that. There is like the stuff you have to do online, but it's not like for a grade, so that's nice.
That's good.
That's good.
I just wanted to say one more thing too, just from what Alex just said, is that when you do start nursing, you don't have like a ton of homework or assignments or anything like that. Like you still do, like we have banner learning courses that we have to do, and they are pretty heavy towards the beginning, so you are a little stressed. And on our floor, like we have to do like ACLS and all that stuff. That's besides the point. Basically, like we only work 3 days a week. I just wanted to add, like, you're gonna want to feel like you just want to lay in bed all day, like on your days off, because your 3 days on are so much, and you don't drink any water, so you literally feel like you're hungover. And you find it because you don't, like, you walk all these steps, you're doing all these things, you're physically, emotionally, and mentally just drained. But just take that time to still just do something that you like. Try and see the sun, because there are days where you just want to lay in bed because you're just like drained. But just try and take care of yourself. I know with nursing school, I mean, at least like for us, like we had to still go to class and everything like that. I know it's even harder for you guys because you're online for the most part right now. But just take that time to take care of yourself. It's also gonna be like pretty different because now you're actually getting paid to learn and go and do something instead of paying to do it. I don't know. I think I got a little crazy when I first started making more money at first. But yeah, just trying to do something that you enjoy and something that's gonna make you happy and stuff like that. Because I think a lot of things, like especially where you go into, it can take a toll on you because especially like during COVID, I don't know if I can speak for Alex or not, but I just felt like I was letting my patients down a lot because there were 5 of them and you couldn't do a lot for them during the day. But just I guess my whole gist of it is just to kind of protect your heart, because there are going to be those days that hurt your heart a little bit. You're going to feel a little beat up, but just find something that can help you recover from it. The end.
Yeah, no, that's really good advice. I think the closer you get to graduating, the more you become aware that like, man, this profession's not for the faint of heart. And I think that's why a lot of people, leave the program or they get into their first year of nursing and they decide, whoa, this isn't for me. So it's good to know. I mean, it's good that you're real, and it's not always sunshine and rainbows. It's definitely a hard career to go into, but I think it's worth it. And I'm super pumped to be starting soon. I can't wait until nursing school's over. It's good and it's bad at the same time. So, man, thank you guys for being here. I really appreciate it. I know you all have super busy schedules, and I hope that our SNA members are going to enjoy this. I know that the thought of graduating can be overwhelming and scary at times, so getting the feedback from people who are in it right now is really beneficial, at least for me, and I'm sure everybody else feels the same. Ladies, do you have anything else you want to add before we sign off?
No, I really appreciate you guys taking the time out of your days to answer these questions for not only us, but for the entire program. I'm sure that everybody will be really grateful to hear your answers and maybe get a little bit of peace out of what is to come. So.